Hello friends! So this will be a different video and I will be speaking in Filipino and English, and I'm not going to unpack any diaper bags this time, but as you can see in front of me here is a first aid kit. Not just any first aid kit, it is actually my son's COVID-19 care kit, which is very timely because of the pandemic. This one here is my son's usual first aid kit for his cuts, wounds, and burns. I won't be discussing this, but leave us in the comment if you want me to. But tonight I'll be discussing my son's COVID-19 care kit. Before I start showing you what's inside this kit, just a disclaimer na lahat ng mga gamit dito ng kit na to is tailored for my son's use. Although there are some items that I'll be mentioning na must have if you want to devise your own COVID-19 care kit for your child, then I will be mentioning some of these items that are needed or if you want to put this in your kit. Without further ado, let's start showing what's inside this kit. So this is my son's COVID or fever first aid kit. Lahat ng mga gamit dito galing Shopee. I'll just link of the items on the description box and check it out. So open this up. As you can see, there's a scratch paper attached there in the cover, but this is actually the I printed this out just in case if I'm not around, or well, some of my family members taking of my baby, and hopefully not, but if something happens, at least they would call these numbers. Or you can download this Pure for Citizens app. I actually downloaded this on my phone and tested it out, and it really works. May tumawag na sa akin when I actually activated the alert. I said false alarm because I was texting out, and of course just to make sure if it really works, and it does. I have the app here on my phone. I'll show this to you guys. So app, and so you have here the numbers. Well, this is the number of the emergency in mga ibang services, and integrated na yung one hospital command here. So the ambulance is there. So if you can click on that, I don't want to do it again just in case baka mamaya may mangyari pa. And may magme-message sa'yo or may magtatawag sa'yo. And it really works. So there, Pure Force app. And this is really handy if you can put important numbers, like for example your pediatrician's number. You can put it there as well. I have my friend who's a pediatrician. I have it in my phone number, so at least I can call him, or yeah, you can call also the ambulance just in case something happens. And we'll go to the box proper. Okay, so all of the items here are medical items, of course, and most of them I got from either Shopee, I mentioned earlier, or in some drugstores. So this one here is ear thermometer. So this is by Braun. This is actually a very good ear thermometer and very accurate. I decided to invest in one because I think my son will use this. No, we will be using this for a long time. Ear thermometer is actually very accurate. I prefer this rather than the non-contact one, the infrared that placed in the forehead, or the digital one. The digital one takes time, no? So this one is very accurate and fast. And another digital gadget that you need is this one. So this is a pulse oximeter. Of course, this measures oxygen saturation of your child. So I got this off in Shopee as well, and this is from China. Took around around 2 weeks for this to arrive here in Manila. But the good thing about this is rechargeable and it's powered USB-C. And at first I tried this out, it really needs a bit of a learning curve. Kailangan talaga may position na talaga para read well yung pulse and yung O2 saturation. So I'll just open this up lang. For my son, so he's actually 19 months, the range of the normal oxygen saturation is around 97 to 100%. So that's the normal. If it goes below that, then of course you have to be wary, contact your pediatrician. This one's a must. You have to monitor your oxygen level of your child. This one here, this is the insert of the for the ear, which you put it here on the ear tip of the thermometer. So it's a plastic there. So this one's actually for my son's use only. Medicine dropper. When my son had his flu last year, I used this. Maganda to. May silicone tip pa. You can put I think the medicine here if you want, not to draw. It's actually nice. And we'll go to this one here. So I have the usual medicines that are needed. The paracetamol. This is cetirizine for allergic cough or allergies, just in case. And yeah, ambroxol or expectorant. So for cough meds, and this one's for his fever, especially you have your cold fever here as well, and an extra medicine dropper. So that's all for the first level. Let's go to the lower levels. It's actually pretty interesting. So this one here, during any viral infection, most of our babies would get dehydrated. For COVID, especially, I think for the Omicron, I'm really not an expert, no, but you may have to research more. The symptoms are respiratory, but for the pediatric population, they get gastrointestinal symptoms. So meaning, yung sikmura, nakasisikmura sila, and at times, nagkakaroon sila ng vomiting and diarrhea. They get dehydrated easily, yung mga bata. So this is a good thing to put in your kit. This is Pedialyte 45. So oral rehydration salt 45. So there's a 30 and a 45. The 30 is for, I think, mild dehydration, and 45 is mild to moderate dehydration. You may ask your pediatrician on what age pwede yung 45, but for my son, I checked na in case he could have moderate dehydration, then he's okay with the 45. Okay. So, and this is the fruity flavor. Ang shelf life nito is 2 years when not opened. But if you open it, your kid has to consume this for at least 1 week. Or else, of course, it will be contaminated if you just leave it more than a week. See, this one's a nasal drops. Of course, for my son's age, I don't think he can tolerate this nasal spray yet. So this is a sodium chloride buffered nasal drops. But for older kids, they can have the nasal spray. So this one is to decongest their nostrils in case it gets stuffy, from the colds. The symptoms of COVID, they're similar to the usual flu. Very handy to have. We'll go to some of the devices here na hopefully hindi magagamit. I have another extra paracetamol here. This is a urine collector for kids, for pedias. Doon iihe at tas ko-collect lang. Kailangan silang mga fluid samples ng baby, and hopefully the urine is viable enough to submit for the laboratory. Bigay na lang sa nurse. So tipid sa oras na rin. Okay, so we won't waste time. And of course, hindi mo alam kung mag-wiwi yung baby mo, kung kailan. So this is really nice to have. These are for your for my baby's respiration. In case kung yung oxygen saturation bumaba, unfortunately, here at home, we have an oxygen tank with a gasket and a valve regulator. We have the adult oxygen mask and cannula, but of course, pag ilagay sa pedia, I don't think hindi kaya yan. No? So, at least I have two. This one's a nasal cannula and an oxygen mask. If you know how to do CPR, as physicians, doctors are required to do basic life support training every year, I think every 2 to 3 years. And this one's actually good buy, especially if you know how to do your CPR. So this is a CPR mask, and there's an instruction here. So at least hindi na kayo go mouth to mouth with this pandemic. Baka mahawa ka rin. And this is a one-way valve that will minimize the chance for you of getting infected as well. You blow through here, and air passes through the airway. And this one's lalagay sa mouth ng your baby or whoever is CPR mo. And of course, a sterile gloves or a latex glove. and alcohol preps here. I think that's it. So if you have any questions, so you can leave in the comments some questions. I'll try to answer when I'm able. But of course, it's better to ask your pediatrician first in case that of the medicines that you will be putting in your kit. Of course, this one is just the kit for my son. It's particularly for him. And I asked also my pediatrician friend. Sabi niya, it's actually nice to have a kit nga in case something happens. So there. So hope you enjoyed this video. It's pretty long. This is actually one of the longest video I did because this is actually a very an impromptu type, no? Very ad-lib. Ito ad-lib ngayon to eh. If you like this video, so give it a thumbs up and subscribe, and I'll see you in my next video. Bye!